Many people start taking drugs or first engage themselves are in an activity voluntarily. Addition of drug will take over their self-control, but these drugs are commonly used in medical field. In this video, we are going to talk about one of the addictive drugs, cocaine. Cocaine is a type of strong and highly addictive stimulant substance that made from coca plant leaf and is known as coca. It can be used for legitimate medicinal use by healthcare providers, such as local anesthetic for certain operations. As of 2020, cocaine had become the second most trafficked illegal drug in the world. Cocaine can be differentiated into cocaine with coca paste and hydrochloric acid, or crack cocaine in free base form. Every year, around 40 million to 21 million people use cocaine. This number decreases every year because it's replaced by other drugs. According to the American Academy of Ophthalmology Head and Neck Surgery study, they recommend cocaine as a beneficial anesthetic and vasoconstrictor when it's used as a part of doctor's care for patients. No other single pharmaceutical substance incorporate cocaine anesthetic and vasoconstrictive effects. The most common uses of cocaine is anesthetic, especially for the people who serious injuries such as skin burn to cause loss of feeling or numbness. After using cocaine during surgery, there will be less bleeding at the point of incision. Cocaine is a very short-acting drug. It's usually too slight to get rid of the residue after the surgery. Cocaine has great side effects, so doctors will not use it unless they have to. The user also needs to observe closely during the recovery period to see if there is cocaine withdrawal reaction.
Cocaine is well absorbed when administered via mucous membrane, the gastrointestinal tract, and intravenously. It has a short half-life of 15 to 60 minutes and is extensively metabolized by Al-Aidrus enzyme, mainly in the liver and plasma, with just around 1% excreted and a change in the urine. The eliminated metabolites consist mostly of benzoyl-lignine, the major metabolite, and other significant metabolites in lesser amounts, such as adenine, methyl ester, and adenine. Although cocaine has a short half-life, elimination half-life of cocaine metabolites are substantially longer. Benzoyl-adenine can be detected in urine within 4 hours after cocaine intake and remain detectable in concentration greater than 150 nanograms per milliliter, typically for up to 8 days after cocaine is used. If consumed with alcohol, cocaine combined with alcohol in the liver to form cocaine ethylene. Studies have suggested cocaine ethylene is both more euphoric and has a higher cardiovascular toxicity than cocaine by itself. The pharmacodynamics of cocaine involve the complex relationship of neurotransmitters. The most extensively studied effect of cocaine on the central nervous system is the blockage of the dopamine transporter protein. Dopamine is released from the presynaptic neuron and travels through the synaptic cleft to the dopamine receptor on postsynaptic neuron, which trigger the good feeling. Normally, excess dopamine will be reabsorbed back to the presynaptic neuron by a dopamine transporter. However, when cocaine is presented, it binds to the dopamine transporter, preventing dopamine from being recycled back to the presynaptic neuron. This results in the dopamine accumulate in the synaptic cleft and thus increase the concentration of dopamine in the synapse and activate postsynaptic dopamine receptor, which make the drug rewarding and promote the compulsive use of cocaine. In addition, cocaine is also a local anesthetic agent. It blocks sodium channel activity and thus prevents the generation and conduction of the impulses in electrical active cells, such as myocardia and nerve cells.
In this section, I will be talking about the effects and toxicity of cocaine. There are a lot of side effects of consuming cocaine, from having headaches to heart attacks. Some examples of the long-term effects include brain damage, stroke, severe depression, respiratory failure, and etc. In this video, I will be focusing more towards how it affects the brain. Cocaine increases the dopamine level inside the brain circuit, which is related to the control of movement. Small doses of dopamine travel through your brain cells to indicate pleasure or satisfaction. When cocaine is consumed, dopamine will flood the brain. This excess blocks the communication of the brain cells. As this continues, the dopamine will also damage the structure of the brain which will lead to blood clots and stroke. As for the toxicity of cocaine, the lethal doses are estimated at 0.5 to 1.3 grams per day by mouth, 0.05 to 0.5 grams per day by the nasal route, and 0.02 grams per day by the parenteral route. Cocaine addicts can tolerate up to 5 grams per day. Cocaine is a sympathomimetic agent, which is functioned to mimic responses of endogenous catecholamines of the sympathetic nervous system. Toxicity occurs as a result of overdose. Cocaine increases the adrenergic activity at the alpha and beta adrenoreceptors, as it is a sympathomimetic agent. This causes sinus tachycardia, a health problem in which the heart beats faster than normal. As a result, causes myocardial infarction and cardiac arrest.
In conclusion, cocaine is a stimulant drug that is abused by smoking, injection, and intranasal snorting. Although it will give a temporary intense feeling of happiness after taking, but it will have a much more adverse effect such as increase the risk of stroke, myocardial infarction, blood infection, and sudden cardiac death. In the medical sector, cocaine can be used as local anesthetic to assist with painful treatment in the mouth or nose. Thus, we need to make good use of cocaine and not misuse it.